There are a lot more drugs that can be administered kind of outside the doctor's office. Typically you would have, let's say, an oncology regimen. Those typically get carved out, but even still, um, those were always reviewed by nurses because, again, there's a lot of concomitant therapy and um, PA that has to be reviewed for administering the drug and location and who the provider is, etc. But there are more and more drugs coming out which are falling under the medical benefit, which can be self-administered or home administered. And we're just finding that the other big piece of it that we're focusing in the talk is talking about bringing the review under one kind of area of the house, if you will. Right now, medical and pharmacy are very siloed, whether that's drug or not. So drug reviews, medical service reviews, radiology, DME, right? That's very siloed. So typically drug is in one area in the pharmacy area, and then everything else is kind of under the nurses and medical directors and the medical side of the house. But what plans are seeing is that when you put these together, that because it's a whole patient care, you're actually having access to be able to see all the data, be able to make a complete analysis and review and a complete review for but also the administration. And so some plans, and again, you'll see the data for Blue Cross Michigan, some plans are seeing that there are cost savings by combining these areas. And so it's increased efficiencies, decreased number of vendors and tools that you have to do because you can use one tool is integrated. And then again, just this same person is reviewing a lot of data for that one patient. Botox is number one. So that's a great example. Some other drugs that we see are Remicade, which is used for autoimmune diseases. We'll see IVIG quite a bit. We'll see the osteoarthritic drugs, Euflexa or Synvisc or any of those for like knee injections. A lot of those will be administered. So we'll see a lot of those being put in. And I have a slide that we can see that the trend is increasing, that we have more and more customers over the last decade that are using the application to be able to review drugs under the medical benefit. And we also see a trend just industry wide, right? Everyone's kind of seen under pharmacy the evolution of, okay, we started with phone and then we moved to fax and then we had some portals and now we have EPA. And the EPA has been around, for over a decade, but that really got bumped up in the last probably 5 years or so. And now we're seeing that same sort of ramp up for the medical side is plans really trying to figure out how can we move this to a more electronic mechanism. And so there's a lot of pieces there. There aren't a ton of tools out there, but there are some industry changes that are happening to be able to move some of the medical benefit reviews for drug and for non-drug over electronically. The biggest advantage is really keeping everything in one system, being able to integrate different systems into the one system, also being able to see a holistic view. So we'll have a way to integrate. You'll get a request that might be for a pharmacy drug, and you'll be able to see previous claims for medical drugs as well as pharmacy drugs, as well as past cases that were for medical, whether that's for that drug or not. So then you start to get a whole picture of that patient. What drugs have they tried that maybe weren't medical, that are typically first line therapy, and then maybe it's had to escalate and need a drug that falls under the medical benefit, but then you can see the progression for that patient, how they've maybe moved through their course of therapy.